Madrid last week amid the tightest biosecurity, but died this morning, his body swiftly cremated to minimise the chance of Ebola spreading. He's one of just 3 people treated with an experimental drug known as ZMapp. The others 2 American aid workers are recovering. In a highly unusual move, global health experts said it was ethical to offer untested drugs to Ebola patients.
In the past 10 years, research efforts into Ebola treatments and vaccines means that for the first time we have a range of potential treatments and vaccines. They could be potent assets supporting our efforts to control Ebola virus disease.
ZMapp is the only experimental drug which has been used so far. It's created by exposing mice to Ebola. Their serum contains 3 antibodies which are then grown in tobacco plants. But there are just 12 doses. All have been allocated or used, and there'll be no more until the end of the year. Another potential treatment is to use serum from patients who've recovered from Ebola. There are also antiviral drugs. As for prevention, there are 2 vaccines in development, but all of these have only been tested in monkeys.
We have to make sure there is informed consent from the patient, if the patient is conscious and able to give that, otherwise from the family or the community. And we also have to ensure that data is properly collected and the cases are well documented so that we will get information on whether or not these treatments work.
Global health officials said there'd been limited research into Ebola drugs because it was largely a disease of the poor in West Africa. The virus can overwhelm the immune system, but intravenous fluids